So I'm Dr. Eleanor Daniel. I'm a rural GP and the Director of Clinical Training for Yorke and Northern Local Health Network. In this video, you're going to meet some of our local GPs and some trainees who are going to give some insights into what life is like living and working in our region. Our network has the best of both worlds. Trainees will get excellent clinical experiences and supervision. They'll be able to explore all the network has to offer, as well as being within a couple of hours from Adelaide. Trainees will have exposure to a wide variety of clinical presentations. They'll treat patients from birth right up until older age and palliative care, and it's going to challenge them, but it's going to grow their skills and develop their confidence in a way that they won't get in a metro hospital.
As an intern here, you would get more direct contact with that breadth of medicine rather than being at the back, kind of in a group in a ward round.
You get a lot more exposure to stuff that you wouldn't get in, like as a metro intern. For example, I work in the ED. Other than just sort of working at patients, you get to get very involved with resus as well.
Not having to fight to get your opportunity to put in a gelco or a cannula, but having a huge range of opportunities available to you for training and teaching and experiences.
There's a lot of things that from the metro side is normally the medical officer who do it, but here, because of the limited work staff, you will normally have the first hand-on to do it and then report back to the officer.
You're going to be at the front of it, so although that might seem a little bit scary at first, you're going to be well supported by our whole team.
We set up a really good training environment where everyone feels very supported, and we work very much as a team rather than individual doctors in consulting rooms.
And that gives you better training, better exposure, more experience, which I guess makes it easier. You're less concerned, you're less worried about some things because you've seen them before, you know what to do.
Being able to start off in a rural generalist training role from day one of your internship is pretty unique to this area, I think.
The GPs or rural generalists here are also the emergency doctors and the hospital doctors. We get to see the whole breadth of medicine. We sort
of have a great mix of all the different domains of rural general practice with anaesthesia and obstetrics and surgery.
We see sepsis, we see trauma, we see chronic disease management, mental health crises.
A rural medicine general practice makes you a complete doctor. You need to know a little bit of everything. We GPs run the town, the hospital. We look after the patients. There is continuity of care.
Being an intern here has exposed me to a huge variety of conditions, and also giving me a lot of opportunities to be very hands-on.
I was working in the city at the time and saw how great her job was here, and how the sort of work-life balance and community feel worked really well. So I decided to come up and join, and I've loved it here ever since.
It's also a sensational community to raise your children in. It's wonderful to be able to have them grow in such a safe place, but also in such a community-minded place. There's lots of opportunity for them to do lots of different things.
I had a rural placement as a med student, so I was quite familiar in some sort of sense what I was getting into. And I really loved it as a med student, so I actually did choose to come up again.
My husband and I have really settled in Clare. We've built a property just outside of the town, so really putting down our roots here because it's a beautiful place to live, as kind of in a nutshell.
I like to explore with my small car, so I've been to lots of the neighbouring towns, exploring all the historical sites and just having a good feel of what the rural country is like. I think it's the best of both worlds being an intern in the Yorke and Northern network. You're getting lots of exposure and doing many different things, conditions, clinical skills, and you're also very close to lots of interesting towns, CBD or Adelaide is very close as well.
So I can go back to Adelaide to hang out with my friends and then have a couple of dinners and watch some movies on it. And also in the same time, I can practice my rural medicines here.
It's the best of both worlds because it's both professionally and personally fulfilling. So professionally, I get such a breadth of practice and I see such a wide variety of patients that it's very rewarding, but also professionally, I have the work-life balance that I need. So I have a 7-minute commute to my home by the beach, and that's moving from one town to another.
We certainly don't have to compromise on facilities and cafes and restaurants and things like that. So it certainly doesn't feel, it feels like it's the best of both worlds, really.
Our Yorke and Northern Rural Doctor Program will be starting in 2025. We're going to be bringing our interns, pre-vocational and vocational doctors to the region. We're building the program so that we can take doctors from medical graduation all the way through their training right up to being a rural GP or rural generalist. We'll be offering advanced skills training in multiple clinical areas based on the interests of the trainee. There are 3 larger hospitals in our network. These are Port Pirie, Wallaroo and Clare, and there's several smaller ones as well. They have GPs and rural generalists caring for patients of all walks of life. These are jack-of-all-trade doctors who do their general practice work as well as caring for patients in the hospital. Some will deliver babies, some do anaesthetics or surgical procedures, and others will help the local ambulance services with serious traumas. For these doctors and for the trainees working with them, there's never going to be 2 days that are the same. We're offering trainees 3 to 5 year contracts, as well as additional benefits like housing and relocation allowances. We're developing an education program in line with the new AMC guidelines, as well as offering extra educational opportunities like regional X-ray licence and rural emergency skills training to prepare doctors for working rurally.